Hey guys, this week in our series for McKenzie, we're talking about how we use the McKenzie method for extremity joints. And when we say extremity joints, we just mean joints away from the spine, like our shoulder, our elbows, hips, knees, ankles, all of that. So Ryan and Nolan already talked about how we can use the McKenzie method for the spine. We can also use it for the other joints. But one of the biggest things we need to make sure of when we have someone that we think we're going to work on with an extremity joint is that it's not actually coming from the spine in the first place. A really cool study was done. It's called the Expo Study, and it showed that 43.5% of overall extremity joint pain, so again, this is pain that's occurring outside of the spine, had a spinal source. We see all the time where people think they have carpal tunnel, they think they've got hip or knee pain. None of those areas aren't hurting them, but the problem isn't in those joints specifically. And then when we can properly classify and rule in the spine and treat the spine, the extremity pain goes away. So McKenzie method, again, we use it for the spine all the time. We can use it for extremities, but really, really important to rule out the spine because of how frequently the spine will send out weird pain signals that will appear just in the joints. So when it comes to extremity McKenzie method exercises that we do with our patients, to keep it simple, it's really the opposite of what we do when we sit all day long. Most of us have desk jobs. When we're seated, we're rounded forward, our shoulders are forward, our head comes forward, our hips are flexed about 90 degrees, our knees are flexed, and our feet are flexed. So in general, we can just take our joints in the opposite direction. So if our arms, when we're seated, are normally forward, we can extend our shoulder the opposite direction. For the most part, our elbows are flexed. So if we extend them, we tend to have better motion, more pain relief. Same thing with our hips. We just want to extend and do the opposite of what we're doing while we're sitting. Just like with the spine, we do these motions incredibly repetitively. So we're giving patients in the office usually like 30 to 50 reps of these to make sure that we're going to give them an exercise that's going to be helpful and address their specific complaint. And then as they go home, they're doing 50 to 100 at least reps of these movements per day. So we'll take you out and show you some of these extremity joint repetitive movements in action.